A lot of times we do the alignment real quick. It's the ASIS, which is the bone down here on the hip. There should be a line up over the knees, down through the second toe. All right? What that means is if she opens up wide, her ASIS, if I put a line over it from the femur, a direct line, that would be way outside the foot. Can you see that? And if it's too close, which I see some people do, that line coming up, if I put that pole, we put a pole there yesterday. Actually, it's right here. If I put this pole from her ASIS going straight over her knee, you can see that this line is going to be in line with inside her feet. We want that line to be right over her second toe. Okay? So if I take it from here and I drop it straight down, look at that, right over that second toe. And that's a good way for you to kind of set it up. I wouldn't use that with clients, but when you're teaching to your friends or whatever and you're trying to get that feeling of finding where the position is, it's from the second toe up over the knee into the ASIS. Right? So the next thing we want to do is we want to make sure that their feet are almost in an extended position or a plantar flex position. A lot of times when they go to get into this position, they're going to drop their heels down. Go ahead and drop like this. What that does is that allows the energy of the motion not to go through the full leg and go in opposition. Now, a lot of times we like oppositional lengthening, right? We use that a lot of times. And sometime during the exercise, I might do that later. But for right now, when I do foot series, I'm warming up the legs, but I'm trying to get proper articulation in the hip. I want to see the femur rotate in the acetabulum. Okay? We have our x-ray vision where we can imagine where the bones are, right? I can imagine her bone coming straight up and down, but from the outside, I can actually see where that acetabulum should be. Okay? I'm also seeing that we have an inguinal ligament. Now, she has baggy enough pants that you can't really see the inguinal ligament because of her clothing. But I can see what's going on with her body, so I'll be able to tell what's happening with the inguinal ligament. Okay? So, keep those heels up. All the toes are touching, right? From the little toe to the big toe, metatarsal. Okay, what's the metatarsal? You guys remember what the metatarsal was?
Bones of your toes.
Huh?
Balls of your feet.
The balls of your feet. All right? So they're really the knuckles of the feet, but the inside knuckles. Right? So push all the way out. Lengthen all the way out. Now, we can look at her and we can see that she's slightly posterior. We can really see it when they get out. When they're down, it's hard to see because their knees are up. So a lot of times I'll have them push out before I get them in a position. What also can happen is they can get their gluteus maximus or their redundant tissue or their butt in the way and they can't get to neutral. So what I do is I have them lift their butt up. Can you lift your butt up? Off the table, set it back down. When she sets down, she's actually in a neutral pelvis. Do you notice that? And that's a really nice, easy way of doing it. Now, it's not guaranteed she's going to be in a neutral pelvis, but it's more likely that they will be. All right? So, we're going to have her keep her heels up, and she's going to bend her knees to come on down. Now, she has this tendency to want to go wide. She's already lost that alignment. Can you guys see that? She went wide with her legs. It's just a nice, easy V. It's almost like this V should match this V on her feet. Okay? So push on out. Lengthen on out. And come on down. And push on out. And come on down. Now what we're watching for is we're watching for nothing moving up here. Okay? And we want to see kind of a drop and a glide with the hips. Do you see how the hips aren't affected but the legs are moving? You can actually really picture that socket right there, right? Can you guys pay and imagine with your mind that you can see her actual greater trochanter rocking back and forth? Okay, and she's doing a good job with that.